I really appreciate the invitation for me to be part of the 11th MSSC. Maraming salamat sa PSSC. Siyempre sa aking kaibigang si Odette Portos, biased siya for me to be part of this. It's really my privilege to be talking to you today on a very important topic. And I'm very happy that we have young people here with us. No? Sila talaga yung kailangan makarinig din ito. So, my talk will be about adolescent health and responsible parenthood, shaping policies for child protection and well-being. I would like to talk about PAPCOM, now CPD. Just to introduce my agency to you, because we are actually working with other agencies and other stakeholders as regards population issues and social issues with economic issues, add to that mix environment. So I will talk about demographic trends, child marriage, adolescent pregnancy, some protective factors and risk factors, existing policies, programs, and interventions. And you can see there the wealth of information and possible research and research gaps that we need to work together on. So I'm very happy about the launch of PCRN. So what is the PAPCOM now? CPD, Commission on Population Development. We were created in 1969 through an executive order by President Ferdinand Marcos Sr. During that time, in the 70s, all countries were experiencing population growth. So at that time, actually, the time of my mother, on average, number of children of women was 6. So on average, 6 children to a woman through her reproductive life. You will see later that this has gone down. It's now 1.9, from 6.0 to 1.9. So the population issues now are different. The Executive Order 171 actually just created a group. If you know Dr. Mercedes Concepcion, she headed the Commission on Population then. And the instruction of the President was, Commission, you look into population issues, especially our population growth, and how we will be able to address the consequences of population growth. Then in 1971, Republic Act 6365 was enacted, and this is where the actual responsibilities of PAPCOM were listed. And this became the Population Act of the Philippines. It has not been amended. So my office is now looking at a new Population and Development Act, given that the population issues now are different. Further, the President, again, issued Presidential Decree 1979, where this is where PAPCOM became how we called Commission on Population. And in 2018, so when PAPCOM was created, it was first under the Office of the President, then it went to Department of Health, then it went to this Department of Social Work and Development, back to the Office of the President, to NEDA, National Economic Development Authority, then back to the Department of Health, and we were with the Department of Health before 2018. In 2018, President Duterte issued Executive Order 71, wherein PAPCOM was renamed Commission on Development. So the development was attached to PAPCOM, emphasizing that population issues affect the country's development. So it was not just about managing population, but it's really looking at all population issues that could enhance development or create barriers to development. And of course, Sabi mentioned earlier, demographic dividend. And this is really the battle cry of my office. We should be doing policies, programs, so that the Philippines experiences demographic dividend, which is really socioeconomic development, socioeconomic progress that a country experiences because of the changing population structure, specifically more working age population. Of course, there are other requirements there. It's not just having more working age population, but the quality of working age will also be addressed. And just this year, RA 12145 created the Department of Economy, Planning and Development, DepDev. So this was NEDA before, now it is DepDev. And there's a section there where CPD, Commission Population Development, is listed as among the attached agencies of DepDev. So we're hoping na hindi na kami pupunta sa kung saan pa and we remain with DepDev. So the vision of the Commission Population Development is that we will be the lead, we are the lead agency in advancing the country's population and development policies and programs towards increased share and opportunity of each Filipino in socioeconomic progress. And our mission is to strengthen institutional capacities to formulate, coordinate, and implement integrated population development strategies, policies, and programs based on socioeconomic and demographic data, information, and knowledge. May I say something about population policy in the Philippines? Our country does not say to women and couples, you should have only this number of children. We don't have a one-child policy, we don't have a two-child policy, we don't have a three-child policy. Our population policy is that of human rights. Women, couples have the right to choose their number of children and how they will space these children. And no interference to the decision-making of the couples. But the role of all government agencies, but especially Commission Population Development, is to provide information. To provide information for couples, women, to make decisions. And to provide services and assistance for them to actualize their fertility intention. So I would like to say that because now there is a question, and you will see, we are still a growing population, but the growth is slowing down. And soon we will be considered an aging population. So I'm always asked, so what does that mean? We stop family planning. We now, no. Family planning is not about having less children. Family planning is about teaching couples, women, how to decide on their family, specifically number of children. So we had the Population and Development Plan of Action 2023 to 2028, which is anchored on the Philippine Development Plan, but focused on population issues for the PDP to be actualized. I would like to thank Dr. Enrique Tus and Mr. Will Villones for being PSSC for helping us write this development plan. And the President has already approved this through a memo circular. So what is our population situation? If you look at this graph, you have first, the column graph, you have our population count. So in 1948, there were just 19.2 million of us. Then in 1970, this was when the President or Congress did the Republic Act, which is our Population Act. There were 36.7 million of us. And so you can see that we still are a growing population, and we are now, based on the 2024 census, where you Na-census ba kayo? Dapat yes, no, kasi census, lahat counted. But of course, actually, the census has limitations. There are some areas in the country that are not included in the count. Pero konti lang naman yun. So, there are already 112.7 of us, 113 million. We are still a growing population. However, our growth is slowing down. So take a look at the line graph. The line graph naman shows our population growth annually. So it's an estimate based on the census. So during the time of President Marcos, the population growth rate was 2.9% annually. Then it increased to 3%. Then slowly it slowed down, and you have a deep decrease from 1.6% annually to 0.8% annually. So that's the situation of our population now. It's different when PopCom was created. At that time, we were growing fast, approximately 3%. And this is our famous population pyramid. So the population age, sex, population pyramid, I'm showing you only 2015 and 2020 because the Philippine Statistics Authority has not yet released the age, sex pyramid for 2024. And as you will see here, we divided the different population groups into three. The middle one is our working age population, 15 to 64 years old. That is the statistical definition of working age based on international standards led by the International Labor Organization. So you will see that in 2015, the share of working age population is 63%. In 2022, it grew to 64%. And for the young population, 0 to 14, from 32% share of the population to 31%. And by percentage, our older persons, 5%, if you express the growth in whole numbers, it's still 5%. But you can see that the growth from 4.8 million to 5.9 million from 2015 to 2020. 101 million in 2015, 109 million in 2020. And the household size in 2015 was 4.4, in 2020 it's 4.1. So it's consistent with the slowing population growth, the number of the household size. This is total fertility rate. How do you read total fertility rate? This is on average the number of children of a woman in her reproductive age. So this is what I told you before. During my mother's time, 6.0 children to a woman. And in 2022, from the National Demographic and Health Survey, it became 1.9 children to a woman. Now please, statistics provides decimal places. And you will think, bakit may decimal yan? Tao yan pinag-uusapan natin. So, how do you read this? I suggest you read it this way. If you have 10 women in the 70s, in 73 specifically, you invite 10 women to a congress. And you tell them, bring all your children with you. So 10 women, 6 children each. How many children would that be? 60 children. PSST will provide for 70 people, accommodation and means, transportation. In 2022, if you invite 10 women, you tell them, bring all your children. How many children will you have? 1.9 per woman, 10 women, 19. So 10 women will have 19 children. You will have to prepare for 29. Look at the difference, 70 to 29. That is the implication of growth rate, which is coming down. You can have more resources. Government can provide for more resources because you have less people to prepare for. That's simplistic, but that's how we can interpret total fertility rate. There is what we call replacement rate. So we do not say you should have this number of children, no. But we talk about what we call replacement rate. This is like how many people you should have in your population to replace the couple. So dalawa kayo, ilan dapat yung anak para ma-replace? So actually replacement rate is 2.1. Therefore, in the Philippines in 2022, our total fertility rate is already below replacement rate. And this, I believe this was presented also or mentioned by Xavier earlier. Our Philippine population is projected to transition to an aging society. Malapit na, in 5 years, 2030. But what is the definition of aging? So we're using the UN definition, which is if you have a population wherein the share of population of 65 and above is 7% or above, that's already aging. So the share would be more than 7%. I think it will be 7% in 2030. I'm sorry. And so we will soon really have the situation. Please look at the blue line. We are going to have more working age people, 15 to 64. We will have more older people, the orange line, 65 and over. And the projection is we will just stabilize on the number of young 0 to 14. And this is called demographic opportunity. Meaning we are moving towards this population structure where you have opportunity for more people to take care of the dependents of the young and the older people. But let me say it now, that is not enough. For us to really beat demographic dividend, meaning more economic progress because of the changing structure of the population, our working age should be of good health, good education and skills. So the discussion earlier of Sabi on health is a big issue because how can we have productive working age if they were stunted as children? They were part of the wasting group when they were children. How can you have productive working age if the boys don't finish school? They're not in school. And if I may share with you, if you look at statistics, our men are in elementary occupations. These are minimum wage or even less than minimum wage. Our women are in the service sector. So this is our situation. The boys are very important. We talk about women and girls, but we should not forget boys. So, but we still have other challenges, uneven distribution of population across regions, higher unplanned fertility among women and girls, with less education, lower income, and in rural areas. We still have stunting, and under 5 infant neonatal mortality rates remain the same. They have not grown, but they remain the same. Students' performance in PISA, we have lower quality of education compared to other countries. And I will be talking about adolescent pregnancy among 10 to 14. Adolescent pregnancy among 15 to 19 is going down, but 10 to 14 increasing. Imagine, these are children. We have not been thinking about reproductive health education really for this 14 and below. We were more on the older adults. adolescents. So this is now about child marriages. We already have a law prohibiting child marriages. It is a criminal offense to facilitate child marriage. And marriage here is not just legal, but cohabitation as well. So even cohabitation, facilitating cohabitation are of children, and children is defined as 18 and below. Okay? So very important for us to define what is a child, what is an adolescent, what is youth. So let me just look at my notes here. So just to give a clear definition that the Philippines uses, and this is how Philippine Statistics Authority produces its statistics, where the definition of child is based, the definition of youth, child are all based on our laws. And adolescent is 10 to 19. And this is based on statistical standards. So as you can see, please, we have been having less child marriages as registered in PSA from 2021 to 2023. And this is, I believe, because of the law. However, they still exist. Child marriages still exist. 233 girls were married, were registered as married by PSA in 2023, 71 boys. And percentage of registered marriages involving a child by age of partner, males of below 18 had women partners under 15 to 17 and 18 and over. And most of the partners of males below 18 are are 15 to 17. This is something that is worrying the case of females. Females aged 18, most of them had partners 18 and over, 73.6%. And let me go straight to this. Okay, the most number of child marriages are, let me focus on in 2023, please, the last column. The most number of child marriages are in BAR, Region 12, Region 9, Region 10, and Region 11, and these are all in Mindanao, plus Mimaropa. So these are Muslim and indigenous peoples. Among adolescents, so in 2023, and I go now to adolescent pregnancy. In 2023, 1 out of 10 registered live births in the Philippines were born to mothers aged 10 to 19. And among adolescent births, 2% were born to mothers aged below 14. So let me emphasize this. The prevalence of adolescent pregnancy is not that high. It's just 10%. Actually, about 9.8%. Not yet a high prevalence rate. But my office is not talking about prevalence rate. We are talking about trends. So the prevalence is still not of concern, but the trend is of concern. And the trend of concern is, please look at left, those under 15, it has been increasing through the years. Older adolescents going down. So this is another. And may I show you, it's not a first time birth. It's repeat pregnancy. So please take a look at this third column from the left. 83.6% of births among adolescents 19 years old and below were first time. However, you have 23,000 3,267 births to adolescent mothers that were repeat pregnancies, and 4,220 of them were minors. So look at that. Some of them even had fifth children already. And this is the issue because we still have a restraining order to provide family planning services to minors without consent of parents. So the issue is they've had children already. So they keep on having children because they don't have access to services by themselves. So may I just focus on this? If you look at this left pie, what is the age gap between fathers and adolescent mothers? Let me focus on this. If you look at this teal or green, 20.6% of partners of adolescent mothers are 6 to 10 years older. The orange one, 8.6% are 11 to 20 years older. And you have this neon yellow-green. You have 1.4% father more than 20 years older than the adolescent mothers. And these are in the civil registration and vital statistics system. That means recorded. We are not even able to capture those that did not register with the civil registration vital statistics system. So why are we concerned again about adolescent pregnancy? Women and girls in the country continue to die from preventable causes related to pregnancy and childbirth. So maternal mortality is still a problem. What are the causes of adolescent pregnancy? This is a conceptual framework. Possible causes are institutional factors, where you have environmental, educational and school factors, socio-cultural factors, but you have family factors, parental skills and guidance, interpersonal relationships within the family, attitude and norm and behaviors related to sexuality, and sexual attitude and behaviors of family members. Then you have peer factors, peer values, exposure to sexually explicit content, group dynamics, peer support system, engagement, and risky activities. And risky behavior includes alcohol and drugs. Media factors, accessibility to social media without supervision, and you have individual factors, intentional sexual activities. Then you have individual demographic factors, sexual abuse, coupled with unprotected sexual activities, and so this results in adolescence. So that's conceptual. So we need to have studies, research to test this conceptual framework. And the Northern Bukidnon State University, where you have the highest prevalence of adolescent pregnancy, Northern Mindanao, did a study of correlates of adolescent pregnancy. What are the correlates? They reside in urban areas. Now they don't have access to productive and educational services. They're out of school. They are in early relationship cohabitation. They come from low-income families. And this was mentioned also by Sabi, the longitudinal study of the Filipino child, which is done by the Office of Population Studies, University of San Carlos, being supported by UNFPA, DepDev, UNICEF, USAID, I believe. And so this is a longitudinal. So in 2016, they chose 5,000 10-year-olds. And they monitored them through the years, even during the COVID years. And so what happened? What were the results? So protective family and household factors during childhood, which provide or promote their being on track in school. They have fewer absences. They have higher grades at age 16. They are in the higher wealth index, so higher, better socioeconomic status. They are FAR-P's beneficiary for those poorer families. Mother is at least a household graduate. Mother believes child can achieve college education, and less violence at home as witnessed by a child. So you do the flip. Those that will have risk are those opposite of this. And risk factors of children at age 11 associated with ever having sex at 16, being male, being poor, being off track in schooling, having less educated mothers, not reached high school, ever had a boy or a girlfriend, have ever chatted with a stranger online, have witnessed violence at homes. These are the children at risk to have started sex by age 16. Girls at risk of getting pregnant at 16, less likely if they're in school and they're close to their mothers. More likely to get pregnant at 16 if already in union, smoking, consuming alcoholic drink, watching pornographic videos, and having friends who ever had sex. Do you see a pattern now? Less education, poorer, but the FAR-P's intervention for the poor families seem to be working. But mothers keep repeating, they're always there. That is why our concern in my office are children left behind by OFW mothers. Their mothers are not with them, so they are at risk. So actually I requested the University of San Carlos could you please produce data on OFW families where the OFW is a mother, and let's see how it is. I wanted to show this to you. This really got my attention. This was called by University of San Carlos Edad de Peligro. Edad de Peligro. Yung mga nag-Spanish. These are the ages at which the children are at risk of leaving school. So these are the Edad de Peligro for girls and boys. Males tend to drop out after grade 6. Then grade 9. Then grade 10. Because they are not interested in school and the family has financial difficulties. Females tend to drop out also at grade 6. Grade 10 a year later than the boys because they're already in union. Grade 11 also financial difficulties and possibly again due to being in union and being pregnant. So these are our problems. Yes, we will have more working age population, but if they were not able to experience grabbing opportunities of better education, better health, they will have to work harder. May I share with you that I also do some, I try to ask about stories of adolescent pregnancy. Marami din namang nagiging adolescent mothers sa mga mas middle class and richer. So nangyayari din yan, but because the family can afford to still bring the child to school and take care of their grandchildren, the girls still are able to have all the opportunities that those who are not yet mothers have. Kaya, the poorer sector, the mothers of lower educational attainment, these are where the government has to have intervention. And I was so sad when the adolescent pregnancy prevention bill died last year because we will still continue to do interventions for our girls to lessen the risk of adolescent pregnancy, but that bill would have provided budget for those at risk, the poorer girls, the ones that are usually it's really poverty. So that really died, and so other legislators have now refiled the bill, and we hope that it will really be approved. So we have actually a lot of laws that protect our women and girls. They're all there. We have the Magna Carta of Women. We are very proud of this as a country. You don't have this, I don't think other Asian countries have this. And already there's Section 32 there of protection of girl children. Republic Act 9262, Anti-Violence Against Women and Their Children Act, BAUSI. You also have an act prohibiting, I mentioned this, child marriage, promoting protection against rape. So this was increasing the age of consent. And you have this one, Responsible Parenthood Reproductive Health Act. This is where I mentioned the restraining order of preventing minors to access family planning services and commodities without consent of the parent. And we have an executive order 141. We don't have a law, but we have an EO which says addressing the root causes of rising number of teenage pregnancy is a priority as a nation, and mobilizing government agencies for the purpose. Thank you very much for your time.